So we're here this morning to talk about COVID-19. I think some of you have heard some of my presentations so far, so some may be repetitive to you, but I think you'll notice new information.
Yeah, and the main purpose of this is for the public to hear this, so most will not have heard that, so don't worry about being repetitive to us.
Okay. So, as you know, COVID-19 hit Florida on March the 1st. There were 2 cases that were picked up in Florida, and at that time, the governor declared a state of emergency, and the state surgeon general also declared a public health emergency. But we had been working on this, the local health departments had been working on this as soon as we saw the situation that was evolving in Wuhan, China, and dusting off our plans for pandemic flus, which this is not a flu, but it is similar as to how it spreads. So we've been working on that. We take our direction from, the Department of Health takes their direction from the CDC, to which the local health departments take their direction from the CDC and the Department of Health overall. Our epidemiology department continues to investigate possible COVID-19 exposures, just as they did and do with other reportable diseases and new viruses. If you'll remember what happened with H1N1, Ebola, and Zika, we investigated those things and followed up, and we do the same thing now. We are prepared and we continue to investigate. Okay. We've been working with our community providers, such as the hospitals, EMS, fire, emergency management, the school district, clinics such as the Neighborhood Health Clinic, and the healthcare network of Southwest Florida. In fact, we have now a community partner call that occurs once a week. And then if there is additional information that comes out, we make sure that that's either faxed out or emailed out so that everybody's up to date at the same time. We're beginning at this point in time to offer small community presentations upon request. But again, we're also trying to avoid unnecessarily bringing together large groups of people into small spaces. So it's something that we try to work with the people that are requesting so that we can do social distancing at the same time. Okay. So on this slide, you'll see the situation changes daily, if not hourly, as to how many cases are in our state. And this was current as of noon yesterday. But in the same way that happened to our governor when he was here on Friday, it changed last night, so that there is an additional case in Volusia County. So where it says Florida has 18 cases, we actually have had 17 cases to date. And of those, 18 would have been Florida residents. Some of them were diagnosed in Florida, as you can see, 12 of them, so that would now be 13. You just have to add a number here and there. 5 were diagnosed in another state. However, they've been repatriated to Florida. And 1 was confirmed positive, but it was not our resident. So, and it, in that case, still remains isolated in our state. So, right now, in the state, we have 115 cases pending. and we've had so far 140 negative cases. So, and of all the cases that we've done, there are cases that continue, or potential cases that continue to be monitored. So as you can see, there's right now 1,104 people monitored to date, but currently only 302 being monitored. And when I say monitored, those people are self-isolating at home, taking their temperatures, in contact with the health departments daily, so that we know their symptoms, their temperature, and if they pass the 14 days, then they're like the rest of us. Okay. A lot of people are wondering how COVID-19 is spread. It most often spreads from person to person. You need to be closer than about 6 feet, hence the social distancing, and we try to keep people and encourage you to stay about 6 feet apart when you're in community situations. We believe it's spread through respiratory droplets from an infected person who coughs or sneezes, and spread through close contact. So if you shake hands, you're hugging people, then that increases the risk. But it's important to also realize that not every single person shows symptoms that is infected. And so that is evolving into, not only are we concerned about people coming back from the specified countries, but again, we're concerned about close situations with people because you're not sure who would be infected. So the symptoms are much like the flu in the beginning. You have a fever, a cough, you can have body aches, but then the hallmark of COVID for people that morph and progress into being sicker with COVID infection is great difficulty in breathing. So those that are particularly at risk happen to be our older population and people with comorbid conditions such as asthma, COPD, kidney disease. Those are the people that are most at risk at this time. So those symptoms can come 2 to 14 days after you are exposed to the virus. Testing right now is only available through public health. Now that is to change soon. We don't have a specific date. It could be tomorrow, it could be the end of the week. But we are promised that there is going to be commercial lab testing soon. However, right now it's a two-step process. The test that's being used was approved at the CDC by the Food and Drug Administration, who requires that any test that is made available to the states then needs to be confirmed at the CDC. So let's say someone presents to the health department, we send the test in to our state lab, and it goes to one of 3 state labs, Miami, Jacksonville, and on the Panhandle, and then, well, Tampa really has taken over where the Panhandle has been. So they test. If it's positive, then that test goes to the CDC. So when we test it and it's positive, it's a presumptive case. It goes to the CDC and it's positive, it's a confirmed case. And until the cases are confirmed, they are not reported in Florida. So some of the risk factors, the big one is for people that have traveled to the countries that are being monitored, and that happens to be China, it's the big country, Iran, Italy, South Korea, Japan, and Hong Kong. Japan and Hong Kong are considered a little lesser risk, but everyone, when they come back to our country from those countries, are being asked to self-isolate for 14 days. And when you self-isolate, you're staying in your house. If you have family members, you're trying to stay as far away from them as possible. Have a separate room that you sleep in. Use a separate bathroom if possible. If not, practice hygienic cleaning after your use of that bathroom. And do that for the 14 days. Don't go out of the house to go shopping. Don't go out of the house to go to presentations. Stay in your home. So, but it's important to realize, as I alluded to earlier, that the risks may change over time. If this becomes more of a community-acquired virus, then we won't be focusing really on the travel. It's more just on community containment. You need to know there is no vaccine right now, and it's not expected for at least a year. There are no medicines for this. Pardon me. Darn allergies.
How's your breathing?
So, okay, excuse me. So, there is research being done for antivirals that might work with COVID-19. And as I said, at least a year until a vaccine would be developed and available. Right now is the prediction. So what happens if you think you're at risk for having symptoms of a fever, or cough, or you're having difficulty breathing? What should you do? First of all, you call ahead to your healthcare provider, tell them about your travel or your exposure to someone who's been traveling from those countries and what your symptoms are. Also contact your health department. And I have the number here on the presentation. Our epidemiology department would be area code 239-252-8226. If you think you could be infected, you need to avoid contact with others. Don't travel. Make sure, and everyone should do this routinely, cover your mouth and nose when you're coughing and sneezing. The best thing to have is a tissue. Cough into the tissue and dispose of it right away. Clean your hands. Wash your hands often with soap and water for at least 20 seconds. I know that's difficult. You may not be close to soap and water. But the antiseptic hand washes and alcohol is difficult to get these days. So the most effective thing is washing your hands, soap and water, soap and water. But if you can't get to a sink, then that's the time to use your antiseptic hand cleaners. Okay? And for people that don't have symptoms, but they're coming back from those countries, or they've had contact with someone who's coming back from those countries, we still are monitoring them for symptoms for 14 days. So we are requesting them, and actually now four of the countries, so excluding Japan and Hong Kong, we're mandatorily saying that you need to self-isolate voluntarily. But if there is a case where someone is not complying, and we are monitoring those people, I want you to know, but if there is a case where someone is not complying and we truly need them to be quarantined and self-isolate, there is a way that through our legal counsel in Tallahassee that I can compel someone to stay in their home. Okay. So I think we pretty much went over this one. So the measures that I've been discussing about staying home, we need to take this very, very seriously, particularly in our community. The people that are most affected by this happen to be the older population. In our county, we have at least a third of our population that's over the age of 50. And the most vulnerable population are those people that happen to be in the nursing homes and assisted living facilities and the people that are getting dialysis. We need to be smart about this. It's an affluent community. We have lots of people that are traveling all over the world. And though they may have flown back in from South Africa, it doesn't mean that they may not have been to China on their trip. So it's upon all of us to take precautions, think about the people that are most at risk. If you're a son or daughter or a close friend of someone who's in a nursing home and you've traveled to these places, you need to let authorities know. You need to stay out of the nursing homes until you're sure that you do not have the virus. We need to, as a community, practice social distancing, knowing that there is not medication for this, there's no vaccine. The best way we can protect our community and protect ourselves is by hand washing, staying 6 feet away from people, covering your mouth and your nose if you sneeze or you cough. Try to keep your hands away from your face, and it's more difficult than you think if you haven't tried it yet. But let's say that your eye's itching and you just have to scratch it. Well, get a tissue, wrap your finger in the tissue, itch your eye, and then dispose of it. And then that way you're not exposing your eye to other germs. So I've put up here other resources for you to go to. The CDC pages on coronavirus are updated daily. The DOH web pages on COVID are updated daily. There is a call center if you have questions that is open now 24 hours a day, 7 days a week. And that's the 1-866-779-6121 number. And then also you can do questions through the email, and that's covid-19@flhealth.gov. And always, if you have questions locally, you certainly can call your local health department, and particularly the epidemiology number that I placed up there.
Okay, thank you. Just, before we get to Commissioner Taylor, one of the things I wanted to mention to the Commission is that I've talked to the manager about trying to limit our public meetings, items that are not necessary, proclamations and things like that. We're probably going to forego those for a couple of months, then we'll catch up later. Employee awards, those types of things. We're going to try to minimize the crowds that we have here. That's to protect those crowds from any contact. So I want to thank you for giving that information to the public. We do have Mr. Summers is going to make a presentation, and he may answer whatever questions you have.
I don't think so.
All right. Commissioner Taylor?
So have we been able to positively, as a nation or as the world, identify the COVID virus? Meaning, we know that we can identify it. This is definitely COVID-19.
Yes.
How long have we been able to do that?
Well, China was first reporting this, and so it was back towards the end of 2019, and it continued to spread in China, and so through documents that came out and communicated through the CDC, through WHO, the World Health Organization, and we've been following it towards the end of 2019.
Okay, and then the second question, my last question is, can one immunize oneself against it if one, for instance, children, they say they can pick it up and then they slough it. Are they immunized now, or is it possible that this virus can be reoccurring in the same person?
Not enough is known about the virus yet to definitively answer that for you. It is suspected that you can pick it up again. Just like with the flu virus, you can get it year to year. So that's suspected but not confirmed yet.
Thank you.
Commissioner Fiala.
Yes, thank you. You stressed who have come from other countries, but are there certain states within the United States, because people around here also do travel, and if they don't fly or something, they might drive here. Are there certain states that would be more susceptible to having this and bringing it into us that are already, already known?
Well, California and the state of Washington have been the most prevalent in reporting their cases to date. However, that's kind of a false sense of security because now that the testing has become available, every day there are additional states that are finding a case in their state. So, California is a long distance from Florida, but we have cases too. And that comes from travel, most likely. And the virus is not only traveling to us, it's traveling around the country. So just like you try to prevent yourself from having the flu every year, you need to take precautions to prevent your exposure to COVID-19.
Commissioner McDaniel.
And one quick question. Thank you, Stephanie, for the presentation. You talked earlier about the testing. When are the testing methodologies going to be more prevalent and available? I think that just from what I've been able to hear, it's an identifiable virus, and that would really help us contain it more prevalently if we had more availability for the testing. I was pleased to hear about the double checking, if you will, with the testing. If someone does test positive, it goes for another level before there's actually a diagnosed case, and that certainly helps with the human error side of things. So when do you think those tests are going to be more available, and how? And secondarily, how often should people go
For testing?
Yes.
Well, first of all, you should go to be tested if you have come in contact with people that have traveled right now to those countries, or if you are experiencing those symptoms and your doctor has determined, along with the health department right now, that you meet the criteria for testing. There is an algorithm that we are following as a health department that everybody else is following in the state to determine who should be tested and who shouldn't. But once, again, it is widespread community transmission, person to person, and you don't know exactly where it came from, then that algorithm will not be used. As far as the test, the commercial test, I have no specific date as when it will be available. I am hoping the latest count we've been given is that 4 million tests should be available nationally this week. So it could be any day. But I also want to caution you that it could have been last Friday, but there seems to be a little bit of a glitch in producing the tests and getting them out. So once that happens, it will no longer be a two-step process. It will be your provider will determine if you meet the criteria for testing, and they will send the test to the commercial labs, like LabCorp, like Quest, if you're familiar with those.
Thank you very much. Mr. Summers?
Okay.
Commissioners, good morning. For the record, Dan Summers, Director of the Bureau of Emergency Services and Emergency Management. And I want to just briefly let you know that as we have in state statute, as we have in our comprehensive emergency management plan, our state plan, we have a partnership in these particular engagements. We have the plan, as I've mentioned, as you well know, we have a battle-tested emergency operations center that we can ramp up at various levels. We can do a lot of this virtually. We can do some periodic briefings and meetings and training, set the framework, and then if necessary, we can go full activation, of course. All of our activities right now are anticipated to be during business hours, so we're not looking at any particular after-action or after-hours activity. And we just want to remind the community and our partner agencies that messaging is so very important during this event. And we want to stress, just like we talk about in a hurricane, we want a single voice. We work as a single team. That's under Stephanie Vick's direction. Emergency management and the sheriff are unified coordination partners with her, and we want to make sure that we remind the public that our single voice in this case is under our Florida Department of Health and Department of Health Collier. We are working closely at the state level. State Emergency Operations Center is also in a similar posture. They have activated a certain number of emergency support functions that are now working 8 to 8 in the state EOC, and that's to support information management, planning, any resource gathering, any logistical support that Department of Health may need will be there to support that. It's important that this is certainly different from our storm events or our wildfire events. Every step as we work with her team is measured, it's incremental, it's set forth. So while there's a lot of panic and a lot of, I don't want to say panic, but a lot of interest in ramping up very quickly, we'll do that on a measured and incremental basis based on our daily assessments. Our emergency medical services, Chief Butcher and Dr. Tober, awesome as always, have put together their personal protective equipment resources, training, and protocol for our EMS personnel for weeks now. I have the allergies too. For weeks now, our Sheriff's 911 Center has been addressing these calls and asking folks if they've had international travel or if they have flu-like symptoms, so that the crews, the responders, get a heads up as to what they may be walking into. And again, working with DOH, Emergency Medical Services Medical Director, all of those efforts can be ramped up if needed. On the emergency management side of the house, we're fully, all of our resources are, as you would expect, 24/7, 365 are ready. We have the ability to continue our coordination closely with CDC, FEMA, Public Health, and others. We have the ability to do all types of messaging, as we've not only learned from Irma, but we've enhanced those capabilities from Irma. Alert Collier. This is one of these great tools that we have in our back pocket now, and we now have 156,000 contact points in Collier County, if necessary, to make mass notification. So a great tool that we have available, and we encourage folks at this opportunity to go to alertcollier.com, and if you're not signed in, now is a great time to do that. And again, I just want to stress that we can work on site, and we've got a lot of horsepower to work remotely as well. I'm not recommending a local state of emergency at this time, but we'll continue to follow the state Surgeon General's lead on this particular issue. Again, our partial activation means that we're working on this right now in an enhanced monitoring level. Stephanie has told you that this will be a fluid environment, and we on a moment's notice, we can escalate or ramp down depending on the case of current actions. And again, a single voice messaging is so important. We've already had people posing as FEMA coronavirus contractors. FEMA is not here on any official capacity. We've had folks taking CDC information, cut, paste, modify, and put their logo on it, et cetera. And again, we just want to encourage you to let you know that the single voice message here coming from Department of Health is so very important. We are monitoring supply chains, as we've all seen that on the news. We have these bullet points from our procurement department and our ordinance that allows us to continue to address that from a continuity of operations standpoint so that we can continue to operate to the best of our ability. And certainly if we have to get into emergency purchase order type discussions, we'll do that with the county manager well in advance and tie that to a local state of emergency if that becomes necessary. Again, I think we're doing well. I feel very, very comfortable about our framework, our ability to manage, coordinate, work with our partners. All the framework is set and ready on go to assist Department of Health as needed. Alert Collier EM, the additional websites, and again, so that you're going straight to those locations for additional information will be most helpful. And I'll be happy, either one of us will be happy to take any questions.
I want to thank both of you for providing that public information. The purpose of this, again, was to inform the public of sources of information and what the county is doing. And as I mentioned at the beginning of the meeting, we're going to be taking steps to minimize people's exposure here in county government. As a matter of fact, one of the issues that I mentioned to the manager was the curtailing of our advisory board meetings, things of that nature, things that are not necessary. We're going to try to reduce.
What meeting?
Some of our advisory board meetings and things of that nature. That if it's not something that's critical, then there's no need to put anybody at any risk. Again, thank you very much.